Why transitional care? Why now? The healthcare industry is faced with many challenges. Quality of care coordination combined with reimbursement cuts and penalties. Access fragmentation and misalignment of patient care delivery. In today's environment, the most pressing dilemma of all is how this challenged system will handle the demographic wave of aging Americans. Nearly 1 in 5 Medicare patients discharged from a hospital. Approximately 2.6 million seniors are readmitted within 30 days at a cost of over $26 billion every year to CMS. Additional challenges that add to the mix is how to transition the patient back into the community safely, as today the management of care coordination is fraught with poor communication alignment with physicians and other members of the care team, transparency of medical information, medication adherence, and errors to the prearrangement of physician follow-up visits after discharge. More than 10 million Medicare beneficiaries, approximately 20% of older Americans, are living with 5 or more chronic conditions. Effective care management of this population is often complicated by several other health and social risk factors. Unfortunately, multiple studies reveal that healthcare needs of older adults are poorly managed, often with devastating human and economic consequences. When compared to standard care in the reduction of preventable hospital readmissions for both primary and coexisting health conditions, the process struggles in the current structure. However, when paralleled with the transitional care model, reductions of preventable hospital readmissions for both primary and coexisting health conditions can be stabilized. To produce quality outcomes, enhance patient care experience, to reduction in readmissions, and total healthcare cost savings in high-complexity patients, all leading to prevention of hospital readmission and penalties. Research shows chronic diseases make up the largest part of hospital readmissions. In reviewing patients who have been readmitted to an acute facility within 30 days of discharge, there are other prevalent issues at play. On top, medication noncompliance, with a lack of follow-up visit with primary care physicians, barriers in understanding disease diagnosis, to the discharge instructions and medication complications are all areas for redesign. For the millions of Americans who suffer from multiple chronic conditions and complex therapeutic regimens, assures that Home Core Solutions' transitional care model is a unique solution in several ways. Our TCM program is a nurse-led, multidisciplinary approach driven by an evidence-based intervention model where the patient's home is the primary setting of care coordination. With establishment of intervention, the interruption of patterns of frequent hospitalization or emergency department use, and the decline in health status. Restructuring patient-centered care alignment with physicians, discharge planners, and other members of the care team in the implementation of proven clinical best practices. The triple aim approach of our at-home core solutions transitional care model is education, empowerment, and engagement of the patient, their family members, and caregivers. This is accomplished through the utilization of motivational interviewing techniques, teach-back methods, to identify the patient's goals and engagement in the recovery process. The foundation of the solution in reducing readmissions and delivering patient-centered care is an integrated disease management program that, number 1, all involved from the physicians, discharge planners, and clinical team collaborate. Number 2, special emphasis is placed on patient education and empowerment. Number 3, a specialized, trained transitional care nurse is engaged prior to discharge. Why transitional care works? It is an enhanced post-discharge care for your patients. Our comprehensive at-home core solutions bundled service offers an efficient resource for an acute and post facility and works in conjunction with the current transitional care model, safely transitioning high-risk patients from an acute care setting to home and prevents unnecessary rehospitalizations. Our at-home core solutions transitional care management model consistently delivers improved patient outcomes and reduced cost of care among high-risk patients. Our TCM services are provided by a specially trained TCM and care team, visiting the patient within 48 to 72 hours prior to discharge in an acute care facility, assessing medical, functional, and environmental needs prior to discharge, and will arrange for all DME medical equipment, including oxygen, to ensure a safe transition back home. Develops and implements an individualized transitional care plan to prepare the transition home of the patient, assisting in arrangement of follow-up physician appointments, and when appropriate, will arrange for transportation, reviews medication reconciliation, education, and follows the patient with wellness calls throughout the episode of care. Creating a seamless collaboration with health professionals, overseeing the care plan, and the coordination to maintain a healthy status.
Can you describe the benefits of your transitional care model to our facility?
Great question. The benefits of implementing At-Home Core Solutions TCM in your facility are the following. Improvements in health status after transition, with the most important element is the enhancement in patient and family caregiver experience, increasing satisfaction rates, with the main goal of reducing rehospitalization rates and decreasing Medicare reimbursement penalties, while improving the quality of patient care, ensuring moderate or high complexity follow-up visits are scheduled. Supporting patients through care transitions can reduce rehospitalizations, as seen in the colon graphic. Rehospitalization rates for patients who received care transition coaching and patients who did not.
Can you define what are the qualifications to refer a transitional care patient to Assure?
Patients with high complexity diagnoses are the best candidates for enrollment in our At-Home Core Solution TCM program, and are 65 years or older with traditional Medicare coverage and who have had a recent hospitalization.
Can you outline the benefits to the patient and their family members?
Care coordination is secured, giving the patient and their family members a peace of mind as they are discharged back into the community to promote and empower their independence.
Why and how does Assure's transitional care work and differs from our current discharge structure?
Our TCM is a post-discharge service designed to reduce preventable 30-day readmissions by addressing multiple common causes of readmissions, such as absence of understanding the disease management process, medication adherence to the collaboration of care continuance from one setting to another. By providing extensively trained clinicians in geriatric care, the coordination can be an efficient resource to enhance the current discharge process in place today. You all must be thinking, how transitional care can be offered without changing your current operational model? Whether your organization has an existing care transition team or is looking to partner utilizing our transitional care model, Assure can be a supportive partner to reduce readmission by being a seamless extension of the patient-centered care delivery model in use today, working as one care team, focusing not only on disease management, but incorporating measures to promote an overall healthy and productive lifestyle. To learn more about the benefits of our transitional care in motion model and how we can partner together to provide the best-in-class patient care experience, contact our office to get started today.